Good afternoon, everyone. I hope you had a good lunch. I want to thank Dr. Kinney and Dr. Sharma for inviting me to speak about cardiology apps, as well as Beth Oliver and Heidi Garcia for arranging specifically today's symposium. So I have no relevant financial relationships. Traditionally, when you're seeking out some form of education, either there's a new device, new technique, or let's say pharmacology standards are changing, you're going to look into textbooks, which unfortunately are a little expensive, hard to carry a lot of them in your pocket. You have scientific peer-reviewed publications, which unfortunately often require a page subscription, which is not an issue for larger institutions, but you have to keep in mind that we live in a global community with people all around the world. Sometimes access isn't as obvious as it seems. You have wonderful symposiums, as the one today, but often we're limited to hottest topics, such as lithotripsy, for example, really took up a lot of time yesterday. And then we have live case series, such as our own, that just hit 12 full years. But we're centered very clinically, and we can't get too down to basics, explaining what is a Guidewire, et cetera, et cetera. So we try to get around all of these issues by creating free educational mobile applications specifically for interventional cardiologists. So started in 2017 with Bifurcate, and then slowly releasing more and more of these applications, about 2 per year, and then also updating applications such as Octave version 2 and Cath Aid with newer features. We really try to pinpoint a specific target in interventional cardiology and try to help explain from the very basics to complex cases and decision algorithms. So all of these applications, if you want to learn more about them, are available on cardiologyapps.com. I'm going to start very briefly and give an overview of some of these applications before diving further into in further detail. So Bifurcate was the first one to come out in 2017. It has a decision algorithm for both left main and non-left main lesions. You're asked subsequent questions such as what's the status of the patient, what's the side branch diameter, the degree of stenosis, and either a dedicated 2-stent technique is recommended if the stenosis is significant, or you might start with a provisional approach and then you evaluate the status of the patient progressively through more and more questions, and it'll guide you all the way through to bailout techniques such as tap and reverse crush. Here, for example, are just screenshots from DK Crush, so you can see why some people complain about DK Crush being an overly complex technique, requiring multiple recrosses of the side branch, multiple KBIs. That's what the DK stands for, double. The next application, Octave, was very briefly mentioned earlier today during the intravascular imaging talk. In Octave, we discuss in detail both in a web app, so cardiologyapps.com/Octave. All of these little tabs have all the functionalities in the application online if you want to see them on your phone or on a laptop. So on the left side is the application, on the right is the web app. In this example, you see an explanation of what is in-stent restenosis. What does it look like inside of OCT imaging? There's bright little spots that are the stent. There's a pullback. A lot of us are visual learners. We can see the entire pullback of the vessel and understand what kind of treatment might be necessary. Is there calcium in that plaque? Is it just fibrous tissue? Are there 2 layers of stents? Are there 3? Should we look for another treatment plan? We have quizzes that test your knowledge, so you can understand if all of that actually stuck with you. And then 16 very detailed case reviews that go into STEMI, there's rotational orbital atherectomy, there's NSTEMIs, there's spontaneous coronary artery dissections. All these different cases have pre and post OCT imaging, so you can understand in greater detail. Sometimes the angio doesn't quite give you the resolution that you're looking for to really understand what's happening. The next application, Transeptate, focuses on a very specific topic. How do you perform a transeptal puncture for procedures such as mitral clip? There's animations, illustrations, hybrid images with overlays, and interactive videos that can help you understand how that entire process works. So for example, in this mitral clip option, we can see that there's a video of the procedure. There is a little, I guess, game almost, where you click the location and it'll tell you if you're in the right place for that particular procedure. So for MitraClip, you see you would want to click on number 1. The next application, Cath Aid, goes into detail about the tricky coronary reaccess after transcatheter aortic valve replacement. So especially with a younger patient population, you can expect to see more people coming into the cath lab with prosthetic replacement valves in their hearts. So it's important to understand what do these devices look like, which would be back. Okay, sorry about that. So the basic section up here will discuss the balloon and subexpandable valves. The next section will help you understand how do those valves interact with patient anatomies, such as the width of the coronary sinus, the height of the coronaries. And then finally, in the bottom, you can see how do you select a catheter for a patient that's coming in with a pre-existing prosthetic valve. And also there's recommended escalation paths. So if one doesn't work, how do you proceed? We have cases that detail how we achieved coronary reaccess in some of our patients, and then animations, which I accidentally began a little too early. So in these animations, you can see right now the balloon expandable valve, and then detailed text recommending on how to reaccess. We go into detail about how to shape the catheter, advance, when to put in or take out the guide wire, when to use a guide extension catheter for PCI, for example. All of that is explained in detail in these animations. So this is one of the earlier applications, but it was subsequently updated with a web app. So we understand that not everyone wants these things on their phone, though I do recommend you downloaded it. So you can go on cardiologyapps.com and then Cath Aid, and you see all of that content that I just described also within our web application. Then Calcific Aid, if you were here yesterday, you probably saw me tossing up some factoids here. It goes into detail about how to treat calcified lesions. So calcified lesions generally have worse outcomes, particularly because they're hard to dilate. And if you don't properly treat this lesion before stenting, you're going to end up with stent under expansion, which has notably worse outcomes for the patient. So on the very first page, you see bifurcation and non-bifurcation lesions. Undilatable, for example, would be ISR, and then osteo or non-osteo lesions. You proceed to evaluate the calcium on angiographic or intracoronary imaging before being guided through treatment, which is either high-pressure balloon inflation, cutting balloon, or rotational orbital laser, etc. So we just went over these applications here, but I'd like to dive into a little more detail about specifically Complicated, because I think it has a lot of value to everyone, nurses, doctors, technicians, and then Bifurcate 3D, just because it's our newest one. So in cardiologyapps.com, we started tracking analytics about 10 months ago. Since then, we saw 7.7 thousand users, 14,000 sessions, about 50,000 page views, a majority of people in the US, desktop over mobile. And what's interesting is about 2/3 of the users, even more, are under 45. So you can see how a younger audience, especially medical students interested in the field, general cardiology, interventional cardiology fellows, and young career professionals, they're really seeking out this kind of information to help them understand their field. If you click on the apps, the ones that I'm highlighting here have fully featured web apps. So if you're uncomfortable downloading an application, we'll focus on Complicate right now. So the purpose of Complicate is to help both identify, manage, and then prevent complications that happen in the cath lab. If you click on Basics here, or the link inside of every one of our case reviews, you'll see direct information about the complication you're looking for. So inside of the Basics, you see classification information, prevention, management, etc., such as incidence rates. Now, inside of Complicate, we have 55 case reviews. So this is after searching, I think, 10 years of complications from our particular site that has about 3,500 PCIs a year. So you can imagine that we're able to find a large kind of diverse number of complications, even things like air embolism that we'll go into a little later. If you click on cases and you don't want to go through the pretty UI, you can see a list of all the different cases here. All of them have been carefully reviewed, largely thanks to Gurpreet Johal, one of our interventional fellows, research fellow in the 2-year tract. We're going to look at just one such case, air embolism here. They're all presented the same way. We start with the clinical presentation, past medical history, clinical variables, and medications. At any point, there's a little button here, so you can read on the basics about that particular section. We then show the pre-procedural EKG, and then about 800 different angios in Complicate that are described step by step with every single video on this web player, from diagnostic to when the complication is identified, always either highlighted, circled, in some way noted so you don't miss it. Post-procedural EKGs, before being shown a detailed case overview, what happened, how was it treated, and then learning objectives that go into why did this occur, how can we prevent it, and what's an alternative treatment strategy that maybe this never would have happened. So all of that times 55 times and you have Complicate. Now, the next I'd like to talk about is Bifurcate 3D. So this one was available as a web app now for a couple of months. cardiologyapps.com/Bifurcate 3D. It goes into detail about, just like the first application, Bifurcate, Medina classification-based treatment recommendations. In this case, we'll select 111, say the patient is stable, and we'll be walked through mini crush, DK crush, and culotte. In this case, mini crush. So the video on the left, and then you would have timed text over here, but this is just a video clip. But as of last week, you can also download all of these videos and use them for educational purposes. So feel free to do that if you want to share that with somebody. As of last week, we also finally published these on the Apple App Store and then Google Play. So you can download Bifurcate 3D on your phones as of last week now. Within the application, you can use all the same features, read about the basics, understand Medina classification, how to select an appropriate guide wire, how to cross a particularly stubborn stent strut into a side branch, everything like that. There's recommended reading, so you can understand the field of bifurcation stenting, where it started, where it is today. And now I'll show one quick sample use of Bifurcate 3D. So this is a recording of me selecting, I believe, 110. So we'll say the patient has a left main lesion, 110. Click. You have timed text on the right that tells you all the steps, animation on the left. If you click any of the underlined sections, it'll give you a little information about that particular topic. Once you get the end to one of these animations, you're then asked, was there plaque shift in the side branch? Now, if there isn't, then you proceed with provisional stenting. If there is, there are different treatment recommendations. So in this case, we'll say we went provisional, like the Europeans like, and then we're going to say, uh-oh, now there's plaque shift. So now there's a new treatment plan. We have to fix the LCX. We balloon, perform POT, and then the animation highlights the purpose of POT, so you can kind of get an idea of how we're increasing the apposition to the vessel wall before final KBI. And of course, all of these treatment recommendations would be different if you said less than 50. But of course, we're going to make it difficult, so we're going to say greater than 50 again. So in this case, KBI didn't fix it. Now we have to deal with the bailout technique. This is TAP, T-stent and protrusion. All of the steps are highlighted here. And at any point, you can click on the text, and it will navigate automatically to that point in the animation. And hopefully with these animations, you can appreciate some things, such as how the metal stent protrudes into the bifurcation, as it wouldn't with something like a dedicated 2-stent technique mini crush or DK crush. Now we're moving backwards. Every one of these dots, if you click, it'll navigate you backwards to that point. So you can always explore how would the treatment be different if there wasn't plaque shift, or there was. Now, the newest web app, which is not available yet as a mobile application, is Guidewire Aid. So in Guidewire Aid, we have a decision algorithm here for both non-CTO and CTO lesions based on lesion characteristics as well as wire characteristics. So under wire characteristics, for example, if you're looking for a workhorse, you can find that. Or if you're interested in treating a calcified lesion and you need some recommendations, you're told all of the properties you're looking for in a wire that can help you cross that lesion or deliver a device. You're linked to the basics section where you can read more about calcified lesions and coronary guide wires. You're shown examples of such wires that can help you tackle the task. And we have an expansive library of both guide wires and microcatheters, so you can search through what's available in the market. So one example of how I could use this is in yesterday's cases, this particular wire was mentioned a lot, but let's say your cath lab doesn't have this wire. You would find the characteristics such as stainless steel, hydrophilically coated with a polymer jacket, and it's soft, 1 gram, no problem. So we go into the Guidewire library, we narrow down the tip load, we select the core material to be stainless steel. We'd like a wire that's not tapered, atraumatic, hydrophilic, with a polymer cover. And you'll be provided with a list of available wires that suit all those needs. So all these wires are soft, have a polymer jacket, hydrophilic, and non-tapered. In addition to the library, we have cases, 25 select cases in Guidewire Aid about how particularly difficult lesions, both antegrade and retrograde CTO, simple lesions, tortuous calcified, were handled in the Mount Sinai Cardiac Cath Lab. And there's also a lot of cuts from CCC live cases where the camera zooms in and shows you how the wire was manipulated, or there's some snippets from usually Dr. Kinney talking about why a particular wire was selected, and then how it's kind of optimal for that scenario. So in cardiologyapps.com, we've since, I believe, March, amassed about 37.8 thousand unique downloads, with, of course, Bifurcate leading the way, since it's relevant to about any interventionalist. But we also have Octate, which is useful more to kind of imaging technicians. Complicate, I believe, the web app only, is very valuable to about anyone in the cardiac cath lab, since complications is something that everyone has to deal with. And then another one we have upcoming in the future, Device Aid, is particularly valuable because you'll be able to use it as a quick reference guide. You can look up balloons and stents, support devices. You read basic information about every new device if you're being introduced for the first time to it. Or if you're a particularly experienced person, you can just use it as a quick reference to understand what are the specifications of this device, how does it compare to ones in its field. So I want to thank you for listening and also invite you to give feedback. So these educational applications, a lot of them wouldn't be possible without people specifically asking or telling us particular sticking points. So in the case of Bifurcate 3D, the reason it exists is we had a lot of feedback from people for the original Bifurcate. They asked us, can we have animations? These images just, they aren't cutting it for me. And your feedback might end up being the next new cardiology apps educational application. Thank you.